There are essentially two different techniques to harvest hair transplants. The first is FUT, which is basically when we make an elliptical incision in the back of the head. It leaves a small linear scar, and we use those grafts to transfer to the front of the head. The other technique is FUE, or follicular unit extraction, and that's when we take the grafts out individually without any linear scar. Are you feeling all right?
Yeah.
Good. All right, you're gonna feel some tiny little pinches, okay?
Mm-hmm.
There we go, pinch, and a little burn. Good, and a pinch, and a little burn. Are you doing okay?
Mm-hmm.
Good. Good. Doing great. Pinch. Little burn. Good. Pinch. Good. Pinch. Good. How you feeling? A little bit more numb?
Mm-hmm.
Good. Maybe some pressure now, right?
Mm-hmm.
Good. But not too much pain, right?
Mm-hmm.
Good. So what we're doing now is, shouldn't feel this too much, but we're just doing something called little tumescence, meaning that we're putting some fluid in the area, so those little grafts come right up at us, and it also cuts down on the amount of oozing. So there's really very, very little bleeding, almost minimal. You bleed more when you're shaving. Are you feeling all right?
Mm-hmm.
Good. Just putting all that fluid in there. Call this doctor's helpers. It's not really gonna feel anything. It's nothing that you're gonna go through, but it just helps us make the procedure smoother for you.
Mm-hmm.
Good. And that's the hard part. How was that?
All right.
Not too bad, right?
Mm-mm.
Like as long as I keep doing this nitrous, nothing bothers me, right?
Mm-hmm.
Yeah, I got you. Nice.
You're right.
Pretty good, right?
Yeah.
Good. All right, good. So what we're doing is making these tiny little micro cuts around the follicle, and the punch we use is 0.7 millimeters, so it's really, really tiny. It's the smallest one available. And so it leaves these tiny little baby holes, and those things close up within a couple days. And when they heal, your hairdresser or barber or whoever, they won't even be able to see them. It's like they're essentially invisible. It's pretty cool. Any pain, discomfort? Okay.
I'm okay.
Good. Show you here at the bright light. So these little guys here, if you look carefully, this is the follicular unit, and this is a real beauty because it says, you can count how many hairs are in each one of these. This is probably about 3, and this is a 2 or a 3 right here too. Really beautiful. And once we remove them, we put them immediately in solution. It's called hypothermosol and ATPV. It's a special solution. Similar components to what they use for solid organ transplants like kidneys and hearts and lungs and stuff like that. And it keeps it exactly at 4 degrees centigrade, which is the perfect temperature to keep it healthy and preserved while it's outside the body. And then, you know, within a short period of time, we actually implant them. So they're not out of the body for too long, but when they are, they're in this special solution called hypothermosol. And it's exactly at 4 degrees centigrade, which is a kind of a scientifically proven way to keep the grafts preserved and healthy. Once we take the grafts out, this is a special chiller. It's called a cold chiller, and what it is essentially is a special device that keeps the grafts really, really cold, at about 4 degrees centigrade or so. That's the kind of the ideal temperature. And we put them in this special container, and this contains a special solution called hypothermosol. We talked about that preserves the grafts while they're outside the body, and it keeps them perfectly viable, so that when we implant them, they're all essentially perfect and thriving and healthy.